Welcome to another episode. Today we'll be talking about the oral exams. Many medical students are usually very afraid when it comes to oral exams. Some degree of tension is normal. I mean, you are not going to be coming into the exam or to face your lecturers who know much more than you about that subject, and you would not be afraid to some extent. Don't allow fear to get the better of you. So that is the first point when you are going for an oral exam. You must learn to motivate yourself. Before you go in there, you say, I can do it. I can do it. I'm not afraid. I can do it. I will approach the question and say what I can say about it. That's the mindset to have, not the mindset of, what's going to happen to me now? Will I pass this exam? No. Encourage yourself, motivate yourself. That's what they call ginger. Such that even if you don't know anything, you feel that you will be able to attempt the question. Because oral exams can go in any way. You may come in with a full haircut and we'll start asking you about your hair. You come in with a beard and we'll start asking you about your beard. You may have a Man U wristwatch and we'll talk about Manchester United. God help you that you know about Manchester United. You are wearing a Manchester United watch. So the orals are such that it's just an interaction. What we usually try to do is to make it objective. So occasions where we talk about Man U, they are rare, because if you then talk about Man U, you will not fail a candidate because it doesn't know about Man U. You get it? So we usually try to make it very objective. So the way we organize your oral exams are usually you would have two aspects. You have an oral 1 and an oral 2. Sometimes it's just one oral stations. And what are the possibilities? There will be a sequence of questions, maybe 1 to 20, and you're going to pick numbers. So that way it makes it fair, meaning that the next person can pick the same question you picked. Before I go on, do not ask. If you are doing an oral exam and the first person comes in and you ask the person, what did they ask you? And he says, this. Do not ask the person what their answer was, because you might have given a wrong answer. So are you going to go in there and tell them the wrong answer? Always focus. Do your own exam. Don't ask too many questions. Once it's time for the exam, focus on the exam and go in there. Now, so when you pick a question, look at it, take a deep breath and ask yourself, do I know the answer to this question? There are different categories. It might be like you have no idea. That means you're a bad student to start with. It may be that you know it so well, you are very confident, and in between, you are neither here nor there. If you are neither here nor there, I think you should still attempt that question. If you don't know it at all, you have no idea, then don't just keep looking at the examiner and staring into space. Request to pick another question. Pick another question. The only thing is, you cannot pick another question and then still say you don't know anything about it. That's disaster. It already means you are a bad student. Now, if your knowledge about that topic is average, the reason why I think you should still answer it is because if you ask to pick another question, you cannot be certain that the question you are going to pick, you are going to know much more than this one. So attempt that question first. Now, in attempting questions in the orals, just go by first principle. You give the introduction. So if it's something you can define, you define it. If it's something that you can give a little bit of epidemiology of, you go ahead and do it. And then you talk about, you go through the sequences. It's still the same sequence. If you are asked to talk about how you manage a patient with obstructive jaundice, don't say what obstructive jaundice is. Go on to the clinical features of obstructive jaundice, the laboratory features, the causes of obstructive jaundice, and then the management. Usually you are not going to have more than 3 or 4 minutes, and you're supposed to answer 2 questions. So just to run through them. We just want to know that this person has a good grasp of the topic. Once we see that you do, we're going to ask you to pick the next question, and you're going to get your full marks for that particular question. So if you're very comfortable with the question, you do that. If you are averagely comfortable, you still do the same thing, and then we go on to the next question. The other things you find in your oral exams are instruments. So things like urethral catheters, endotracheal tubes, oropharyngeal airways, gloves, cannulas, syringes, nasogastric tubes, drainage bags, colostomy bags. Those are the things you are going to find. Fluid giving sets, blood giving sets. So those are the things you regularly find on the wards. I always tell you, when you are on the ward, make sure you find information about everything, because we are only going to ask you questions of things that are found commonly. IV fluids like normal saline, dextrose saline. You cannot come to the oral exams and we ask you what fluid this is, and we give you dextrose saline and you say you don't know what this is. Or we ask you what you are going to use it for and you say you don't know. That's bad. Every day while you're on the wards, make sure you pay attention to all those things. In the oral exams, they ask you to pick. Say, pick any instruments there, pick any of those medical devices. You will be the one to pick yourself. So if you know, out of the things I've mentioned, if you know 5 of them, you will be able to pick one of them, because we will ask you to pick. So there's every chance that whatever you pick, you will know about, and then you'll be able to answer the question. When you are speaking, be confident. Do not be overconfident. If the examiner asks you whether you are sure, if you are sure, say you are sure. Don't guess. Because sometimes when we ask you if you are sure, we just want to know if you are just guessing or you are confident of what you are saying. So when we say, are you sure? Don't just say, don't begin to waver. If you have said something you are sure about, stand by it. If, however, you have said something that you think is wrong and you think you just guessed, and the examiner gives you a cue as to, no, that's wrong, quickly withdraw it. Quickly withdraw it. Don't argue with the examiner and say, no, I'm sure. You cannot keep arguing with the examiner when you are not sure what you are talking about. Right? Remember to greet when you come in. They'll tell you to sit down, and when you are done, remember to also say thank you. Generally speaking, like I said, we want you to pass those exams. So we would likely give you a pass mark once you say something that is reasonably good enough. Catch you in the next video. If you have questions, write the question in the comments and I'll answer them.